If you are managing metabolic dysfunction alongside skin inflammation, tackling both simultaneously requires precise tools. We are going to build a customized botanical infusion designed to target both of these physiological pathways at the exact same time. This protocol relies on two specific biological components: dried persimmon leaves and dried fig leaves. Before we begin, we must establish a hard medical baseline. This protocol is an adjunct lifestyle tool. It must never replace your prescribed pharmaceuticals, insulin therapies, or standard dermatological care. Over the next few minutes, we will break down the biochemical mechanisms of these leaves, identify who must strictly avoid them, detail the exact gram weight recipe, and establish a mandatory monitoring routine. Approaching natural botanicals with the exact same rigor and precision as medical protocols allows you to safely extract their benefits while preventing dangerous physiological interactions. We start with the persimmon leaf. Its primary systemic targets are improving lipid profiles, managing blood glucose levels, and supporting overall vascular health. On the left of this diagram, polyphenols in persimmon leaves actively downregulate glucose and lipid markers. On the right, fig leaf compounds interrupt inflammatory pathways associated with eczema. In 8-week human trials, patients consuming this extract showed measurable, sustained improvements in skin health. Fusing these two distinct pathways creates a unified botanical matrix. You are simultaneously supporting metabolic glucose control while actively suppressing skin-level inflammation. Combining these specific botanicals is a deliberate stacking of complementary biochemical pathways designed to address multiple facets of complex chronic conditions. The ideal candidate for this protocol is an adult actively managing mild metabolic markers or mild skin inflammation through diet and lifestyle. There are two absolute contraindications. Anyone with a history of photosensitivity or severe allergic reactions to fig sap or fig leaves must avoid this entirely. Look at the red zone on our clinical contraindication matrix. The critical warning applies to diabetic patients actively using insulin or fast-acting hypoglycemic medications. Both leaves have documented glucose-lowering effects. Stacking them on top of pharmaceutical insulin can trigger a dangerous compounding drop in your blood sugar. Natural compounds are biologically active. Failing to account for your pre-existing medications turns a supportive botanical remedy into a severe physiological liability. Begin with a strict starter dosage. Measure exactly 1.5 grams of dried persimmon leaf and pair it with exactly 1.5 grams of dried fig leaf. During your initial testing phase, your absolute hard limit is 3 grams. The total combined botanical weight must never exceed 3 grams per day. For your solvent parameters, use 500 milliliters of water, heated specifically to a range between 80 and 90 degrees Celsius. To achieve the proper compound extraction, cover your vessel and let the leaves steep for exactly 15 to 20 minutes. Do not treat this like a traditional medicinal decoction. Do not actively boil the leaves on the stove or arbitrarily increase your dose. Maintaining this precise microdosing strategy prevents the digestive distress and potential blood sugar crashes associated with reckless botanical overconsumption. Once brewed, divide the 500 milliliter yield into 2 or 3 smaller servings. Consume these servings exclusively during or immediately after your meals. This mandatory 7-day tracking grid tracks your safety data. You will log your morning fasting blood sugar and your glucose spike exactly 2 hours post-meal. If you experience sudden glucose drops, tremors, or worsening skin lesions, stop the tea immediately. Bring this data to your doctor and say exactly this: I am consuming 3 grams of this botanical daily. If my monitored glucose drops, should we adjust my insulin? Logging your biological data transforms a traditional tea from a blind experiment into a measurable, controllable variable in your personal medical management. Resolving chronic metabolic and inflammatory conditions requires long-term lifestyle compounding. Botanical protocols take time, consistency, and patience to yield results. Before you begin, check the pinned comment below this video to download your printable 7-day tracking sheet. And as a final reminder, if you have existing medical conditions, forward this entire protocol to your primary care physician before you take your first sip. True, sustainable health management occurs when we combine the historical wisdom of botanical adjuncts with the strict discipline of modern medical monitoring.